from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio. This is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about some of the challenges surrounding pregnancy and accessing prenatal care. Our guest today is Abby Olson, Director of Patient Care Services at Sarasota Memorial. Abby, thank you for joining us.
Absolutely, it's my pleasure.
Why is prenatal care so important?
So prenatal care, consistent, good, high-quality prenatal care is the best thing that you can do during your pregnancy to ensure a healthy outcome for mom and baby. So we know that during a pregnancy, there can be some unique complications that come up. The really good news is that most of the time we can provide a lot of preventative care to make sure that we have a healthy mom and baby at the end of that pregnancy. But making sure that you have that consistency in that care really makes a huge difference for those lifelong outcomes for both mom and baby.
Now, in the past, we did a maternity mini-series of HealthCasts in which we dove a little bit more into what some of that prenatal care is. But just to summarize, when someone thinks of prenatal care, can you just tell us what that is aside from when you're pregnant?
Yeah, absolutely. So prenatal care is seeing an OBGYN or a mid-level provider, sometimes a nurse midwife or a nurse practitioner during your pregnancy. And depending on the level of risk in your pregnancy and what's going on, the frequency of those visits might change a little bit. Mm-hmm. In the beginning, you might not see that provider as much, but as you get closer to delivery, you're going to see that check in with that provider more often so that they can check things like your blood pressure and different vital signs, making sure that you had all the necessary testing done so that we know when you come in labor that we know exactly what to look for and what to be prepared for your delivery.
What are the challenges facing those who are trying to get prenatal care right now?
So in our community, which is not unique to us, but certainly here in our community, we are seeing that there is a shortage of OBGYN providers. Mm-hmm. And so it is becoming more and more difficult for patients to find a provider to take care of them during their pregnancy. It is hard to find that perfect match sometimes between a patient and a provider. It depends on the provider's office and what insurance they take, what risk factors that they're willing to accept. So some doctors are specific to high-risk patients, some are specific to low-risk patients. So really finding that perfect match is really important. And with the decreased number of available appointments, that has become a big challenge for patients in our community.
And it's also an issue because we have so many people who transplant to Sarasota. I know that sometimes depending on when you move in your pregnancy, that can impact if an office will accept you as well, right?
Yeah, absolutely. So some of the offices really don't want to take patients later on in their pregnancy. So if they're over a certain gestational age, they might say that they're not going to accept that patient. But we are seeing a lot of patients that are moving in their second or third trimester. And so finding a provider for those patients is challenging as well.
And this isn't just an issue for women looking for prenatal care, because we want to specify that care is ongoing. Mm-hmm. It's not just someone coming to the hospital and delivering, because we do have OB hospitalists who can help with delivery, but it's beyond that, right?
Yeah, absolutely. So our OB hospitalist team is in the hospital 24/7, and they are a very highly skilled group of OBGYN providers that just take care of patients in the hospital. So if you come in and you haven't had prenatal care, they're going to be the team that's going to take care of you at that point. But you're right, when then the patient goes home afterwards, if they haven't had prenatal care during their pregnancy, we really need to make sure that they have postpartum care, because there are some unique challenges in the postpartum period that we really need to watch for as well.
So you kind of mentioned it, but are these challenges specific to the Sarasota community in finding OB care, or is it nationwide? Where are we seeing this?
It really is a nationwide trend. We're seeing it across the country. We know that here in Florida, it's a little bit worse than the national average. And it certainly is something that in our local community, we are feeling it tremendously.
Why is the shortage of providers so concerning, and who is most impacted by that?
Yeah, so I think really the patients that probably require that level of care the most are the ones that are we really worry about. And so those high-risk pregnancies that can't find care or have a difficult time finding that provider, those are the patients that we really want to make sure that we get them into some sort of care so that we can prevent any of those disease processes from becoming worse.
How is SMH addressing these concerns specifically?
Yeah, so here at SMH, we've created the pregnancy care team, which is comprised of OB nurse navigators. And so patients can call and self-refer and ask for help if they can't find an OB provider. The OB nurse navigators then take their information, they gather a whole bunch of information, including what kind of insurance they have, do they need help setting up their insurance, and what kind of risk factors they have for their current or previous pregnancies to determine how to match that patient. So like I mentioned, that match is really important to make sure that you have the right provider with the right patient. And so they're able to work with all of the physicians in the community to place the patients appropriately.
Why do you think it was so important for SMH to get involved in this? Because some people could say, well, as you mentioned before, you have the OB hospitalist, you're ready to deliver people whether they've had prenatal care or not. Why is it so important for the community's health that we get in kind of and help these patients with the prenatal care aspect?
Yeah, I think that's one of the things that I love about SMH so much is that this program is evidence of doing the right thing for the patient. And so these are patients that are calling this pregnancy care team that aren't patients yet, but they are going to be patients here. And we know that if we didn't do something, that we would see more and more patients show up here in OB emergencies, hypertensive crises, different things that we know we can treat and prevent if we have that opportunity to do so. And so being able to stand that program up and help with that navigation is really important to doing the right thing for the community.
We should mention this isn't just an SMH effort. Who are some of the other community partners involved, and what are they doing to help us?
Yeah, it really is a collaborative effort to look at the problem. We have had a lot of different conversations with different groups to determine what can everyone do to pitch in. The Department of Health has started seeing prenatal care visits. They were not doing that previously. So they very quickly found a couple of providers and they could start seeing patients at their clinic. And that has really expanded the capacity for those appointments. And then a lot of our community foundations have really stepped up to the plate to help us, which has been a huge benefit. We have some community nonprofits that are helping out with some early prenatal care and some early ultrasounds. So it really has taken the whole community coming together to help solve the problem.
And the pregnancy care team is not the only service SMH is offering or involved with. Can you talk a little bit about First 1,000 Days and that community-wide partnership?
Yeah, I would love to. The First 1,000 Days is a community collaborative initiative that, again, works with a lot of the organizations in the community to be a point person. So First 1,000 Days is about the first 3 years of your baby's life. And there's so much that parents and families need help with in that time frame that it's hard sometimes to navigate. Okay, I need this help. Well, who do I call and who do I ask? And you can Google things and try to find things on your own, but the First 1,000 Days has family navigators that are that point person that can connect you to all the available resources. And so that program has been invaluable in connecting families to assistance and helping them kind of walk through their parenting journey. And the great thing about the First 1,000 Days already being in place is that the pregnancy care team now just came right alongside it, and they're working together to do both the medical needs and non-medical needs to really have that comprehensive assistance for a family for everything that they need.
It's so important. And how is all of this funded? Because I know there are many generous organizations involved.
Oh my gosh, it's really been just phenomenal to watch the generosity of the community pitch in to really help this. So we have individual donors that have made large contributions, small contributions, anything in between. We have some really amazing foundations that we work with. The Charles and Marjorie Bransick Foundation is hugely supportive. The Gulf Coast Foundation has really supported the program, and so we have a lot of philanthropy that's been poured into this, and it's such an honor to watch a community as a whole rally around something and really do something that's impactful and make a difference.
And we should also shout out the Sarasota Memorial Healthcare Foundation as well.
Course.
They're very involved, right?
Of course. That team is really, they're phenomenal. They're just amazing, and they, again, do what's right for the patient. And so they, we've had a lot of conversations, and they really early on got on board and said, how can we help and what do you need from us? And I meet with them weekly, and we have really good communication about, what the needs are and what the outcomes are, so we can share that with the donors and let them know what we're doing and what we've been able to accomplish so far because of it.
Absolutely. Do you foresee this OB shortage being an ongoing area of need in our community?
I do. The statistics tell us that the OB shortage isn't going to get better, that it's going to become more of a problem. So it's going to be a problem that we need to continue to solve as time goes on. We're seeing a lot of people move to our area, obviously. Everyone is feeling that, but we know that more and more young families are coming to the area. And so making sure that we can get them connected to the right resources as they learn our area, or even if they've been here their whole lives, knowing what resources they have as they go into a different chapter is really important. And I will tell you, one of the most touching comments that we've received so far from a patient in the pregnancy care team was someone that said to the nurse navigator, I finally feel like someone is listening to me. And so just to have somebody that's there, that'll listen to you, that'll hear your concerns, that can be invaluable, and it really can make a huge difference on the health of mom and baby at the end of the day.
Absolutely. If people are listening, they're in this community, maybe they want to either connect someone they know and love, or pregnant mom looking for assistance, how can they reach out?
Yeah, there's a couple of ways that parents or families can do that. One of the easiest ways is we have a hotline. It's 917-MOMS, M-O-M-S. That's area code 941-917-MOMS. And then they can also go to the First 1,000 Days webpage, and there's a self-referral spot there that they can ask for assistance. But if you forget anything else, just remember 917-MOMS, and they can point you in the right direction and get you some help.
Abby Olson, thank you so much for being with us today and answering all of our questions.
Thank you.
And if you liked this episode of HealthCasts, please like and comment, and visit smh.com/podcast to listen to more experts like Abby talking about the health issues which matter to you. As always, we also encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.